You know, in India's biggest cities, you can find these incredible, world-class hospitals pretty much everywhere. But what happens when you drive just a little bit outside the city limits? That's what we're diving into today, this huge healthcare divide and, more importantly, how we might actually fix it.
I mean, it's a question you've probably asked yourself, right? You see these shiny, modern hospitals in the big metros, and then you go to a smaller town and, well, it's a completely different story. So what gives? What's really causing this huge gap?
All right, so before we get into why this is happening, let's just take a second to look at the what. I mean, how big is this healthcare divide really?
Okay, take a look at these numbers. They really paint a stark picture, don't they? A whopping 80% of all doctors are in urban areas, and it's the same deal for dispensaries and hospitals. We're not just talking about a small gap here. This is a massive chasm.
And this number, wow, this is the so what. This massive gap affects almost 72% of India's entire population. That's how many people live outside the big cities. We're talking about hundreds of millions of people.
Okay, so the problem is crystal clear. But the big question is why? Why does this divide even exist? Well, as it turns out, it really all comes down to the money.
Yeah, this is the real head-scratcher, isn't it? You've got this huge, obvious need for healthcare. You'd think private companies would be jumping at the chance to build hospitals there, but they're not. So, what's stopping them? What are the roadblocks?
Well, here they are. It's a perfect storm of financial hurdles. First off, you need a ton of money up front, just to build the place. Then you have to buy all that super expensive medical gear, and on top of all that, you're looking at less money coming in because you're in a smaller town. So the math, it just doesn't work out.
And look, this isn't just us talking. We've got a quote here from Dr. Ashutosh Raghuvanshi, the CEO of Fortis Healthcare, so he knows what he's talking about. He says it takes about 7 to 10 years just to break even. Imagine that, a whole decade of pouring money in before you see a single rupee of profit. No wonder investors are hesitant.
Okay, so we've laid out the problem, and it looks pretty tough. But is there a solution? Well, yes. Let's look at what the industry leaders themselves are proposing. They've actually come up with a kind of prescription for growth.
The core idea is pretty simple, actually. The industry is saying, look, the only way this works is if we change the financial math. And they're proposing a partnership, basically asking the government to step in and help de-risk the investment to make it a safer bet for private companies.
So what does this de-risking actually look like? Well, it's a pretty clear 4-point plan. Number 1, something called viability gap funding to help with those huge initial costs. 2, give these new hospitals a tax break for 10 or 15 years. 3, help out with subsidies for things like land and equipment. And 4, and this is a big one, guarantee them business from day one by making sure they're part of government health programs.
Okay, let's just double-click on that first point for a sec. Viability gap funding. It sounds complicated, but it's not. VGF is basically a one-time grant from the government. It's designed for projects that are super important for the public, like a hospital, but just aren't profitable enough for a private company to build on its own. So the government grant, it literally bridges the gap to make it financially possible. So let's imagine this all happens. The government agrees, the incentives are in place. What does that future actually look like for healthcare in smaller towns? Let's jump into our last section and talk about the potential impact, because it's pretty huge.
And this is where it gets really exciting, because the benefits go way beyond just medicine. Of course, it's a massive step towards universal healthcare. But think about it. It also means local jobs are created. It means people don't have to leave their hometowns to find work. And it means families no longer have to face that awful burden of traveling for hours, losing out on wages just to see a doctor. When a hospital comes to town, the whole local economy gets a shot in the arm.
And this chart really puts it all into perspective. If we use the current number of beds as our starting point, you can see just how much growth is possible with these incentives. We're talking about a huge jump in capacity right where it's desperately needed. And remember, that's not just a bar on a chart. That represents real hospital beds, which means lives saved and communities that are healthier and stronger.
So that's where things stand. We have a clear prescription for how to fix rural healthcare in India. The plan is literally on the table, a roadmap for the government and private sector to work together. The big question now is the will there to actually fill that prescription? Something to think about. Thanks so much for tuning in.